Good morning, everyone. This is Lynn Schrader with KHI, and Brenda Eckert is also with us. I'm hearing a little bit of feedback here. Brenda, if you'll make sure you're muted. Okay. Well, I don't know if you guys can hear that feedback, but I'll go ahead and jump in anyway. We're going to have probably a short call this morning just because I know how busy everyone is, but I want to hit some of the highlights here. So let's jump into our agenda. We've got a couple of announcements. We're going to touch on some employer group issues, Medicare, SHOP Marketplace, and some reminders of some of the healthcare reform updates that are some legislation pending anyway. There's just not a lot going on right now with regard to healthcare reform itself. But let's go ahead. And I have to show you this great picture that Brenda sent me this morning. So if you've had your news on at all today, you've probably seen Brenda on the news. I love it. I love it. So thanks for sharing, Brenda. She's been on the Today Show. I mean, where else, Brenda? I don't know. Fantastic.
Too many places.
Too many, lots of places. Okay. No, that's awesome. And I think you guys were at Iowa Central Community College last night, right?
Yes, and we got moved up to the stage. So yep, we've been on CNN and Fox News and you name it.
There you go. So Brenda's a star. All right. Oh, that's wonderful. So, there you go. Thanks, Brenda. Well, I had to share that with you guys this morning. Brenda sent it to me, and I just thought it was awesome. So there's Brenda, right in the front row there, right behind Donald Trump. Okay. So a couple of announcements. Please know that I know we're swamped. I know you are as well with your 12/1 renewals, making sure that you get those in. They are due today. The 15th is Sunday, but Wellmark's telling us all of those are due today. So if you need any help with that, obviously get a hold of our office, but please make sure you're getting with your employer groups and getting everything submitted that you can today to get those taken care of for 12/1. And Brenda also wanted me to remind you, and I want to remind you, it's not too late to advertise. We've talked about this at last month's call. We talked about it at agent training this fall. We've got additional co-op funds available from Wellmark. So we normally have co-op funds, but they gave us even more because they've allowed us to really target this open enrollment period. They've got ads specialized for that in the under 65 market. We can advertise now. Of course, we're in open enrollment November 1 through the end of January. So if you haven't taken advantage of that yet, please give Brenda a holler. Some suggestions are whether it's a newspaper ad, newspaper/magazine, or a radio spot, or even a billboard. And we've been having some great success with some billboards, and you can run those just for like 3 months, do a November, December, January. And at this rate, we are halfway through November, so maybe a December, January. So please consider that if you want to boost your sales for this open enrollment time and try to get some new customers in the door. And next on employer groups, under this section, I want to remind you guys, well, first I want to make a really cool announcement about a product some of you have heard about. We did purchase a new tool for us to assist you, our agents, with employer presentations and really the employer data that you use to present their renewal. Or it could be used for a new case as well to show them all the options. So Dynamis is the name of the tool. That's the name of the company that built this software. It's cloud-based. I call it real-time budgeting because literally when our staff, and Nakia is just like literally, I know I'm getting trained, Brenda, Nakia, we're getting trained on this following Monday. We had kind of an intro call with them, and we're getting trained. And so you're going to start to see probably soon. It's just the timing. This probably could have been better if we would have known this last summer. This past summer, we could have been trained and been using this tool now. But we are so excited we think what this is going to do, not only to help our efficiencies in our back office, but give you a way to present and a tool in terms of timeliness to show alternatives to your employers. So, for example, can you imagine that you present what you think the employer wants, and then the employer says, "Well, but what if we look at an HSA, or what if we look at an HRA, or what if I change my contribution percentage, or what if I go to a flat dollar amount of a contribution?" So, all these things can be done so instantaneously on this tool. And we've had some agents that have we've talked to about this that have seen it that may be interested in purchasing this, so they have the ability to do that themselves. So we will do this for you, but give you hard copy, if you will, or be on a webinar with your clients helping behind the scenes then to tweak this. So we'll have the logins to this to assist you. But again, if you see, go on, if you haven't seen the demonstration yet, you haven't gotten a hold of us to say, I want to purchase this for my agency, or just go on and look at what the tool can do so you'll be prepared for what Nakia and Tricia and Sarah are going to be pushing out to you from our group team. It's so exciting. So more to come on that once we're fully up to speed, but wanted you to know that it's out there. And I did ask this company who's headquartered like out of Wisconsin, I think the Milwaukee area. The only other company that has this tool in Iowa that we're aware of at this point is Holmes Murphy. So when you talk about trying to present something so cool to your employer groups to keep separating you from your competition, this is going to do it. And I'm going to tell you that if you become really, if you buy this for your agency, and we've got reduced pricing, by the way, for KHI agents and agencies, but if you buy it, I'm telling you, and you use this and you leverage this, you're going to be, you know, head and shoulders above your competition. So we're super excited about investing in this tool for you guys. And for more information, just give me a holler or send me an email. But definitely go look at the demonstration on khiagents.com if you haven't seen it yet. And then don't forget about Healthiest You. We've got some wonderful flyers. Again, there's a presentation on khiagents.com on what this is. But this is a great way to supplement those higher deductible plans with no office visits or limited office visit copays, or self-funded plans, or in particular those qualified high deductible health plans with no office visit copays. So this is amazing tool, great technology and use of technology in a new way to deliver health care. So access to a doctor 24/7, 365, and get prescription meds. And you guys have heard me quote the stat before, 70% of all office visits and emergency room visits could be handled safely over the telephone. So this is for a flat dollar amount, and I've quoted this before, but for a group from 2 to 99, it'd be $9 per employee per month, and that would cover the employee and their whole family. So when you start talking about an employee who doesn't have to miss work to take their child to the doctor, that speaks to an employer. So when you talk to an employer about, I'll call them absentee issues, right, where they've got folks that are gone because they've got sick kids, or they're gone because they need to go to the doctor. If it's simple things like prescriptions for antibiotics, prednisones, you know, pink eye, Tamiflu, think of some of the things that are the basic things. That'll all be taken care of, could be done on a weekend, and the employee rather doesn't miss work. So you see the benefits there, but please, I want to make sure you know about that and you're not forgetting to bring that up. We've got some great pieces on this that you can at least leave behind for your employers. These are good, obviously, by the way, too, you guys. Healthiest You is good for individuals. So if you're selling a lot in the individual market, have some of that information handy. It's $11 for an individual per month to get this access for an individual, any age. Anybody can have this. Seniors can have this if it's hard for them to get out of the house, right? Or families for $15 a month will cover a whole family. So this is good on every single market that you will touch. HR Solutions, again, you should have access to this. It's got just a wealth of information, and your employer groups also can have access to this. So just as a reminder, if you have not given access to your employer group to HR Solutions and you run that business through KHI, please see Tricia, and we'll get you a login ID. We'll get your clients a login ID. We can do a trial. If you've got somebody that it's competitive between you and somebody else, call us up or email Tricia and say, can I have a temporary ID for this client? I need the name of the client, need an email address, and we'll set them up on a 30-day trial, and they can take a look at it, okay? So those programs are out there to help you sell more business, right, and help you provide more value to your clients. And then don't forget about the benchmark tool. And again, Tricia or Nakia are familiar with this. This is the David P. Lind benchmark, and this is just sometimes, again, we forget to offer these things as we're in the flurry of just trying to get the health group renewed. But don't forget about some of these other tools. Again, it's going to set you apart, and maybe you make that follow-up meeting once you've got the group renewed to then talk through benchmarking, and you start to prepare already for next year, okay? So just reminders there from the employer group perspective. And then on the Medicare front, we're all, of course, many of you that play in the Part D space, we're deep into doing those comparisons. I know I have also. We've reported some errors on Medicare.gov. We use that tool. I use that a lot. I know you guys use that a lot. But if if ever in doubt, you can certainly go to the particular plan and enter the drugs there. It just is a time waster, as you know, to try to do that for all the plans. So by using Medicare.gov, for the most part, it's accurate, and use that little qualifier to talk to your clients and just say, this is an estimator. But if you guys are finding what I think some of us have been finding, that the Aetna Medicare RX Saver Plan is coming up as #1 for a lot of folks. Still, the Humana plan is coming up, and that only moved from 1570 to 1840. So a lot of the Humana plans, and we still have to do paper on Humana, but on the Aetna, we found out we can do e-app. We had always been able to do the Coventry, and as we know, Aetna purchased Coventry, but we couldn't get the Aetna apps through electronically and capturing the agent's ID number. So we can get paid and get credit and be tied to that client. But we've got an application now through Aetna called Ascend, and it's a way for you to do an e-app. And I'll just tell you this, I did my first one this week, and I had to call Erica and go, Erica, help me, because I have never seen this before. This language is not intuitive, and plus I'm probably an older dog, right? But I looked at this, and so when you see the screen here where it says meeting, you actually, when you're going to submit an application, you start a meeting. That's the terminology. And then where it says leads, right here, you're going to be able to look at all the clients that you've submitted, right? Or if you've loaded somebody in as a prospect, started a meeting and then ended the meeting. But anyway, it's just an interesting way to do it, but it still accomplishes the end result, which is electronic submission of these Part D apps to make that appointment go faster, quicker, less time for you, just gain efficiencies there. If you have questions on this, get a hold of Julie or Lindsay in our individual department, and they will walk you through and help you figure out what you need to do to be able to get access to this. As long as you're certified Coventry, and that's all Aetna, that's under the Aetna umbrella now, you've got access to all these products, the Aetna and the Coventry products. So, okay, that was the update on the Medicare, in particular with Aetna. Now, I want to talk to you about the shop marketplace and the two ways that the shop can be used. And a lot of times, all we think about is the premium tax credit, or the tax subsidy rather, that an employer could get. And we've been talking about that since this started back in 2014. But I'll tell you something. And actually, it started before that, right? It even started before that. And so the thing that's going to be big about the shop marketplace, I think, going forward, is offering choice to employees and actually having the tool work the way it was supposed to. So what the employer does, if they are under 50 or fewer employees, they can go on the shop marketplace and just use this as a tool to allow their people to go in and register for a product, right? So it's supposed to give the employee more choice, but let's face it, in 2016, the only product that's out there is UHC. So it's not like the employee is going to be able to choose between Wellmark, UHC, and Coventry on the shop marketplace. They're going to be able to choose between either a plan that the employer chooses and says, this is the plan I'm offering, and then the employee simply enrolls this way, or probably what's maybe even better is the employer says, I'm going to pick a reference plan, which generally tends to be a metallic level, a metal level. So maybe I say as an employer, you can pick any silver plan that's out there. And then the employer then determines what contribution level that they want to contribute, right? So it's interesting, but this whole shop, I think, is, as I was talking to some of our staff this morning, they're like, Lynn, with UHC being the only one out there, and we remember Co-Opportunity was the only one out there a couple of years back, right? And once somebody has taken 2 consecutive years, they can't get that that subsidy anymore. But some might still want to purchase through the shop. Maybe they like it. They like the way it enrolls. I am not seeing that traction yet because of this reason right here. I mean, unless they want that subsidy, and I'll get to that in a second, that premium tax credit, I'll get to that in a minute. But this whole thing about offering choice to employees is probably not as big right now, but it probably will be bigger when we have more competitors in the shop. And so I'm gonna say that in this, right, like starting probably after the first of the year into 2016, this is going to be a time where I'm going to encourage you guys to get familiar with the shop marketplace and then you'll be able to help your employers navigate once Wellmark's in 2017, right? So they've already committed that they're going to be in the individual, and because of their market share, they have to be in on the group side. That means the shop. So then you'll have UHC and Wellmark. So think about this. These, again, for those small businesses under 50 and fewer employees, they would be able to go in here with your help, and you'll still get paid on these. And so that's probably been the biggest change that's happened over the last couple years. And through the help of National Association of Health Underwriters, they've made sure that the marketplace acknowledges us. So whether you want your employers to offer choice to their employees in what should be a streamlined, simple methodology of going in, getting enrolled, it's all online, it's all electronic, and you can assist your employer, and you can get paid. This is a good thing. And in fact, I was logging in and playing with it this morning. So some of that it's going to take for you just to go there. I'm going to escape out of here for just a second and go to my browser. When you go to healthcare.gov, and you're going to click on the Small Business tab. And so that's where I'm at right now, and I want you to see that you can say, okay, if I'm an employer, I'm going to click here. If I'm an employee and I'm going to want to enroll in a plan, well, I'm not going to be able to enroll until my employer sets something up. But if I'm an agent, you scroll down a little bit, and when you click about for agents and brokers, this is so powerful. I'm just going to go ahead and click on it right here because it's going to talk you through, look at all this. This is the plan year open enrollment in 2016. How do you get registered to be able to work on this, right? And this is, so as I was playing around with this a little bit this morning, that's what you're going to have to do. And if you need assistance with this, I'm going to ask you, because today is the deadline for 12-1s, don't call and ask our office about this now. Call me, okay? Call me if you need to know about this right now. We're going to be doing some more training on this after the first of the year to make sure people are comfortable, and let's really get used to what this is in 2016 so that we're ready to go in 2017. I'm going to pop back over to the presentation, and I want to mention now that on the next page, this is why we've always thought, or what we've always thought about the shop, getting your small business healthcare tax credit. And if you recall, and this is just kind of some reminders here, this is where I was saying, it's a premium tax credit up to 50% of the employer's contribution towards premiums. So if an employer contributed 75%, 50% of that 75% potentially could be given back to them in the form of a tax credit. Now remember too, only 2 consecutive taxable years beginning in 2014 does this count. So for many people that were in with Co-Opportunity in 2014, they got it in 2014, and because Co-Opportunity was in just for a little bit in 2015, those groups were allowed to continue to take that tax credit even though they had to move to Wellmark, UHC, or Coventry, who was not in the shop. They were a special case made for all of those here in Iowa, especially where we lost Co-Opportunity. So for those groups, that 2014 and 2015 credit has already been taken, then they're done taking the credit, but they can stay in the shop and take advantage of the enrollment and choices and plans that they'll have. So in 2016, UHC is the only plan out there. In 2017, however, we know that it'll be at least Wellmark, plus I'm sure there'll be others. Now, as a reminder of this, for some small groups that maybe are looking at, and I had an agent call me on this just this week, I've got a group, they've been reimbursing individual premiums, or maybe they haven't even been reimbursing individual premiums. They just had a small group, let's say it's 10 people, and they all are going out and getting their own individual policies. And do you guys remember back when this started, a lot of people said, oh yeah, all these small groups are just going to stop their group insurance and they're just going to tell everybody to go get their own individual policies because it's all guaranteed issue, they can go through the marketplace, etc. Well, as we know, the tax benefits of an employer and the employee to get it through the group are significant. And we know now the IRS ruling that came out that said, remember, you as an employer cannot reimburse individual plan premiums to your employees, period. You can't even tell them, I'm going to give you more money so you can pay for your health insurance, okay? That's a violation. They can't do that. They can't tie increase in pay to go buy health insurance, right? So what we're telling a lot of small employers, let's at least look at what the pricing would be. So you get the tax benefit, your employee gets the tax benefit, and maybe you'll get a tax credit if you have fewer than 25 full-time equivalents, and the average salary of those minus any owners or any family members is the wages would be less than $50,000 on average. Now remember too that this 50% credit back will go down. Look what it says here. It'll be reduced if they have more than 10 FTEs and wages are more than $25,000 on average, then the credit gets reduced. So all the way up to, if somebody's right at 50,000 average and right at 25 FTEs, they may not get anything. But it's, so the limit there is, if you have 25 or fewer FTEs, you may qualify. Average salary is 50,000 or less. Take out any of the owners or owner family members in that calculation of 50,000, and then you may qualify for this. Okay, so 2 consecutive. So there's 2 reasons why somebody might want to look at the SHOP, and you need to be able to articulate these because they're going to ask you, so what about the SHOP? Is that something I should be looking at? Okay, so again, it's for businesses under 50, either because they want the employee choice, and you can work with them and you can get paid on these things, or because they want the tax credit, or maybe both. So see me if you have any other questions on this, on the small business health. It's called the Small Business Health Options Program is what SHOP stands for, Small Business Health Options Program, okay? Okay, and kind of in wrapping up here, and then we'll get to Q&A, this is a repeat of what I talked about last month, the legislation that's pending that really I haven't seen any more movement on. Still things that are hanging out there, and thanks again for your support. For those of you that have, I know we had a couple folks recently join Health Underwriters. Mike, Mark, thank you guys. If any of you have questions on that, we have a great way to help you with that. Give you a 3% discount. We list bill it for you, so we pay the bill to NAHU, and we can either, you can pay us, or we can take a monthly amount, which would be about what is it, $375 a year. So, you know, divide that by 12. I think it comes out to, you know, just it's over $1 a day. So what, $32 a month or whatever it is. We'll take that out of your commission if you want to do it that way. Okay. So, and then I want to say something else about NAHU, and then we'll open it up to questions. But we are excited about Capital Conference. You've heard me talk about it. If you have interest in not only going to Capital Conference, goodness sakes, anybody is welcome to attend Capital Conference out in Washington, D.C. It's awesome. And it's funny, once you go and you're a new time person, you can actually submit to try to get your registration fee for the event, which is like $400. Try to get that covered at no charge. So that's cool. But a bunch of us are going out that serve on the board for NAHU, and so you'll have your Iowa contingency that'll be out there. If you have questions or have any interest in that, please see me. Join NAHU if you're not a member, and then think about joining us for Capital Conference, and also think about joining us in a committee capacity, or even maybe someday you'd want to serve on the board. So let me know. I'm president-elect this year of our NAHU for Iowa, and let me know if you have interest in any of those areas, okay? So let me stop there and see if we've got any questions. I know that went really quick, and it's 9:23, but I know everybody's super busy right now, so I wanted to try to condense this as best as I could. And it looks like we might have some questions. And so, yes, Guy, I will call you. Thank you. Yes, this I didn't go over in as much detail as I thought, just due to the timing of everything going on right now. So, yes, I will follow up with you, Guy. I'll give you a call. And any of the rest of you, if you have questions, or especially if you've got some employer groups, maybe you don't even play in that space a whole lot, but you're thinking about it. I love this space, and you know, I tell you, if we're committed to health insurance, and I know most of you that are on this call, this is what you do. To play in the small group space is so awesome. That is great. And then Lynn, Paul says, please touch on the quoting tools available for Wellmark. Yes, yes, yes. Okay, I'm going to go right there. Let me get out of here. And I'm going to go over to the quoting tool for Wellmark. So let's go out to Wellmark really quick, and I want to show you something. I'll at least show you this first one, and then if you've got other questions for, I'll call it non-ACA plans. Oh, okay, and Paul's saying, yeah, they've saved us a ton of time. Let me show you where it is. So when you guys get logged into the Wellmark website, get logged in. Let me get logged in here real quick. then what you want to do is go click right here on the Premium Change Information Center. There's a Go button here. And once you do that, you'll get a choice right here of the Quick Quote tool. There's an instruction guide here, but if you click right here on the Quick Quote tool, and there's several other tools you can see that they've listed there. I'm just going to start with the Quick Quote tool. You can even save this on your desktop or on your computer or wherever, iPad I'm sure. And let it download here. And go ahead, Brenda, if you had something you wanted to comment.
Yeah, I was just going to say this Quick Quote tool is only for the new ACA plans, and then Lynn will show you how to go in and do the Pool 5 rating. But we have found that depending on what version of Excel you have, some agents weren't able to use, but I believe it's the Pool 5 that is a little bit pickier than this one. If you don't have a newer version of Excel, it doesn't work. But go ahead, Lynn, and then maybe we can show some of the little tips that we figured out in here.
Okay, sounds good. So when you look at the effective date box, and I'll leave it at 1/1 of 2016, when you click into the box for which county you need, you'll see the pull down and just say, yep, I'm doing Black Hawk County. Then I can come over here into my member age. Let's see, I've got to move my question box here.
You have to put in date of birth, I believe.
Thank you. There you go. My question box was in the way. It was hiding that box. So you go up here to the date of birth and put in, I'll leave it right now at, well, here, I'll just, for the heck of it, we'll change it to 1986, so it's a 30-year-old. What happens is, when it's interesting, and then, of course, the no or yes on tobacco, right? I'll leave it at no. All of these plans that they've put here can be scooted around in a different order, but if you'll scroll down, let me get to my scroll bar here, and actually I'll just use my arrow key. I'll scroll down to the different plans and look at the rate. So you get this just instantly, you'll get your rate here. And the cool thing is especially if somebody says, you know what, I really only want to look at the HSA plans. And so I could come over here to this box here and see how it pulls down. I just want to have the HSA for HMO right there. And right here I'm going to put the HSA PPO right next to it. And right here I'm going to put, you see what I'm doing? So I can move this stuff around. I'll scroll down to find the other HSAs, which are, I believe, right there. You see what and just do in whatever order you want to put these things, so that when you're showing your client, now I can scroll down and go, now look at these first three that we're looking at, and now I'm comparing the 3 HSA plans, and now I've got my range. Of course, you can add spouses, dependents, etc. Right?
And that
what did I
column,
miss? Yeah, go ahead.
I usually put in the first column what they currently have if you're doing a re-rate, so that way that should match with what their re-rate letter says. And
Perfect.
then, Lynn, do you want to show them, because I hate to show them 500 different options. If I only want to show them 4 options, Lynn, do you want to show them how to get rid of those other columns? Did I show you how to do that?
Well, can you just delete them? Or
click, yep, right where you're at. Just click on that and then hit the delete button. Just click on it and then hit delete.
There you go. So I'm just sitting on top of it and hitting my delete button.
Yep. And then that way you don't
have all that.
Have that garbage in there that maybe you don't want.
Yeah. Very good. So good to put their current option here and then put whatever other options you want to see. And it's funny, if you delete that, you can still come back to it, right? Which is kind of nice.
Yep, you can still go back to it. And then you can actually save this. Like what I do is I start a folder on my C drive that just says 2016 re-rate, and then I save it and put it by whoever's name, because what I don't like is you really can't put somebody's name on it. You have to either print it out and write their name on it or put it in a folder with their name on it. But you can go back into it anytime if you save it and add or change stuff.
Yeah.
So it's really slick. It's real slick for quoting new instead of going in online and quoting.
Very good. Yep. Excellent. Okay. Well, I'm going to close that out. I'm not going to save that. And then what I want to show you is, let me go back over here, back to the Wellmark page, right? And then Brenda, I think, help me here because I haven't done this as much.
Yep.
This is where we go to the Pool 5 rating tool.
Pool 5. Now remember, this is only going to work for your Pool 5 members, because we have agents calling in and say, well, I can't pull up so-and-so, well, because maybe they're not in Pool 5. So it's only for those old pool plans, Pool 5. So if you see where it says Iowa Pool 5 rating tool, you click on that.
Right, that one. Yep.
Yep.
There you go. Okay, so it starts out with instructions.
Yeah, where's the actual?
And then there's the estimated rates.
Oh, there you go. Yeah, go into the estimated rate thing.
Okay. Still loading, just a second. There we go. Okay, estimated rates.
Uh-oh.
Uh-oh, what'd I do?
I don't know. Oh, there you go.
Okay, let me do it one more time. Sorry, I think you don't have to enable editing, right? I think that's what I did one other time, and it made me log in or something dumb. Well, you should be able to enable
editing because you're going to want to edit it when you get in there. I don't know why.
Yeah. Okay, so if I go to estimated rates.
There you go. Okay, there it is.
Okay.
Yeah.
Okay.
And then here's what gets a little tricky, because under column B where you see it says coverage code, there is a 3-letter coverage code that we had emailed to all agents a listing of all of their current customers that were getting a re-rate letter. And in that spreadsheet for your Pool 5 people, there is the code's right on there. And so, Lynn, I don't know if you can go to, I can show you an example of that. Well, let's just do one, and then I'll show you where you guys find that on the spreadsheet. So yeah, for example, this particular client, if you know that their coverage code on the spreadsheet we gave you is H6J, then you go under number of adults. Now, the one thing that some people get hung up on is everything in blue has to have something in there. So if it's an adult, put 1, and then let's just say 0 for number of children, because if you leave that blank, it won't work. 0, and then type a plan. Oops. You have to put single or family.
I'll just do single.
Yep, and then up here where it says the premium, that's off of your spreadsheet as well. So you have to have your spreadsheet in front of you when you're doing this, or it won't work. So
it has to match,
can I give you an example of one I have sitting right here in front of me? It's DCD.
Yep. And I have to pick it. I probably can't type it in.
You can type it in and it'll go to it.
Can I? Okay, let's do that. DCD.
Mm-hmm. And then click on your arrow, and it should have DCD will be the first one. Yep. Okay. And then 1 adult, 0 children, single, and then premium 207.75. And then calculate rate. You push that little thing right there. Oh, you have to enable. Sorry, go up to the yellow and enable it. There you go. Now calculate. What's nice is, okay, on these old Pool 5 plans, they have the ability to switch, but only within their plan family. So this particular client's already on an enhanced 2500. His only options are in the old plans are to stay on the 2500 or go to the 5500 or the 9500. So it's only going to show you the options that the person's allowed to change to.
Gotcha. Okay.
So it's very, very slick. It's nice. So if you have somebody that calls and says, I got a rate increase, they're in the Pool 5, of course you're going to want to give them all options. So I usually come in here, do one of these, and then I go into that other rating tool that we talked about, and then I pull all the ACA plans so that I can sit down and say, okay, does it make sense to switch to an ACA, or should we stay on the old? Do we want to stay on the old plan that you're on, or switch deductibles within the old plan? So at least you'll have 2 spreadsheets that you could show them that has their options on there.
Okay.
Does everybody know what spreadsheets I'm talking about when I say that we emailed those out? Lynn, I don't know do you have access to F-Drive? I can show you an example.
Yes. Well, I know Lindsay sent these out. Just give a call, because I know Lindsay sent them out to you guys.
Mm-hmm. And it has a lot of information. It'll have like the client's name, their old premium, what their new premium is, what the premium difference is, and it'll also give you that coverage code that you need to use the Pool 5 tool.
Yep. Hey, I've got another question, and Donna says, reminder, on the Pool 5 quoting tool does not work if you have Excel 2010. You must have Excel 2013.
Yep.
Okay, thank you, Donna, for that tip. Great, and Paul's just saying, yep, this is awesome, huge time savers. Good, good, good. Yep.
Huge.
Yep. Okay, no, I think this is good. Other questions? I'm not seeing any questions at the moment. Any other questions or any other comments, Brenda, you can think of?
I don't think so.
Thanks so much. Yeah, thanks so much for adding this. Yeah, this is good stuff. And this is, as you guys know, we have until so yeah, let's go through the dates here for these, the Wellmark plans. They will automatically be enrolled into the plan that they have, right? Until, I mean, automatically, you don't have to do anything, right? They'll just stay in those plans. But in order to make a change, right, we're in the open enrollment time to make a change. They should have until, and correct me, Brenda, if I'm wrong, until January 31st.
Right, but if they want to have the change happen January 1, it has to be before December 15th.
Exactly. Yep.
Which most of them want, you know, to change it prior to to January 1, or at January 1, I should say.
Yep, perfect. So we've got just over a month to get these done and make sure everybody's where they need to be. But in case you've got some that haven't made that decision by December 15th, we do have till the end of January. Remember, after December 15th, then they'll get a February 1 effective date. And then if they go all the way to, you know, after January 15th, right? If it's prior to January 15th, they'll still get that February 1. But if it's January 15th to January 31st, that's when they're going to get their March 1 effective date. So it's kind of good news that we still have some time if somebody didn't get moved, or you didn't get in touch with them, or they didn't get in touch with you. So we've got a little bit of time here. But I would target December 15th as your date to make sure you get all these folks, you know, situated.
And Lynn, I'll just add, make sure you guys are looking at those spreadsheets, because if you're not going through there and looking at their options and being proactive and calling your clients, they could very easily change to somebody else, because Blue Cross allows AORs. So we noticed there's still a lot of people on the old plans, which is good for some people. But if you have someone that had a really big rate up, or maybe they were on the Secure Blue Select from years ago, back or Blue Transitions, some of those can save quite a bit of money by switching to the new. So don't just wait for them to call you. Go out there and look at your spreadsheet and see what they have, and do. It's very simple. You saw these comparisons. It's very quick to do. So I would take the time to do it, or you could lose them to another agent.
Yep. Hey, and another tidbit, just talking to Tricia this morning on groups, whether or not you think there might be an employer group that does individual, right, maybe, or they want to look at offering an employer group plan and looking at rates. Tricia was just telling me that UHC's rates looking like they're really going to be nice in 2016. So that just might be another reason why you look at, let's get some quotes on some small group business, whether it's through the marketplace shop or not. It doesn't have to be. It can be off marketplace if they're not interested in that premium tax credit. But lots of stuff going on right now, I know, you guys. So, gosh, I don't see any other questions. And Brenda, unless you have anything else you want to add?
Nope, I don't.
Okay, all right. Well, I know she'll be tied to Donald Trump, so we'll be watching Brenda in the news to see if there's any other activity there.
And just for the record, I just want to say we aren't Trump supporters. We were just there because we are politically involved. They just happened to throw us up there.
There you go. No, and it was right there at Iowa Central Community College. So good for you.
Yes. Thank you.
Yes. Get involved in the political process. That's awesome. All right, everybody. Well, have a wonderful day and a great weekend. And get a hold of us if you need anything. And we'll be in touch soon. Take care. Bye-bye.